Well, good afternoon, everyone, and welcome to the Iowa Cancer Plan Implementation Grants webinar about our FY24 invitation for proposals. Just really excited to talk about this opportunity with you all today. So if you wouldn't mind, I think it'd be great if you wouldn't mind placing like your name and your organization just in the chat, just so that we know where you're from and our staff as well. But my name is Rachel Schramm. I work here at the Iowa Cancer Consortium as a program manager. And if you're unfamiliar, our organization's mission as a nonprofit is to really advance cancer prevention and control in Iowa through advocacy, equity, and collaboration. And we do this in partnership with our members from across the state. So to learn more, I did include a link to our website, canceriowa.org. I also wanted to just point out a couple of our staff on the team today. We have Kelly Siddig, our executive director, is here. We have Liz Orton, our program coordinator, and also Caroline Powell, one of our coordinators as well. So watch for them in the chat too. All right, let's see. The purpose of today's webinar is really just to review the IFP process, and we'll just cover the basics of the grant, talk about some of the changes from previous years if you've applied, but to also provide tips about how to make your application more successful. This is pretty laid back, so feel free to come off of mute or ask questions in the chat during our time together, but we do plan to save time at the end for questions as well. We are recording today's webinar and we'll let you know when it's available, but all documents that are referenced here are going to be available on our website as well. All right, we'll go ahead and get started. So just a little refresher about what the Iowa Cancer Plan is. So the Iowa Cancer Plan is something that our organization and our membership put together to really bring Iowans together around, the shared cause that we have of reducing the burden of cancer in Iowa. The plan the newer plan was released just this January, so it's available all online, but it includes 5 chapters that specifically outline health equity, prevention and risk reduction, early detection and cancer screening, diagnosis and cancer-directed therapy, and also survivorship and end-of-life care. So that's what we kind of like to call that cancer continuum. And annually, we are lucky enough to have both a state and a federal appropriation that our board of directors asks us to go ahead and invite Iowans to apply for funding to support those kind of community-based proposals that are really in alignment with anything that's in the Iowa Cancer Plan. So if you haven't, check out, Liz put in the link there. You can check that out online. So one thing that our board of directors does look at is just different funding priorities for the year. So for FY24, which is our fiscal year starting this July, here are the main funding priorities. So first, it is to address issues of health equity along the cancer continuum, especially pertaining to systemic racism, rurality, socioeconomic status, gender identity, sexual orientation, and other important social determinants of health. The next one is to address cancer control issues that have been more heavily impacted by the COVID-19 pandemic. And those sorts of things include things like missed cancer screenings, missed immunizations like the HPV vaccination, or perhaps increased substance abuse like tobacco. We also, the Iowa Cancer Registry just released their 2023 report that includes projections about incidence and mortality of cancer in Iowa. And so the board would like to see projects that address cancer types or sites that are especially high or rising in Iowa. And some of those are listed here. And Liz, I don't know if you have it, but if you wouldn't mind putting in the link to the report, that would be great. Thanks. So some of the identified cancers that were first in are oral cavity and pharynx, leukemia, melanoma, non-Hodgkin lymphoma, colorectal, uterine, bladder, breast, prostate, pancreatic, or thyroid cancer. So any project that addresses those, the board will look at very closely. The other priorities are just expanding local projects statewide in Iowa. So really taking, what worked in your community or within your health system, and how could we really replicate that across the state? And also just really focusing on like formalizing lasting and broad population change in cancer control through policy and systems change. So I know that's like very broad, but that's something that the board wants to see as well. All right, so just as far as eligibility, I was going to say these, you don't have to be a consortium member right now to apply. However, we do, once awarded, grantees must become Iowa Cancer Consortium members. So that can be as small as like just the $20 a year to pay for an individual membership. But for any organization that might be more difficult, we do have scholarship options available. So we don't want that to be a barrier for anyone. Also, all grant funded activities must be tobacco-free and held at tobacco-free locations, which is very important to us. So like I said, these grants are really intended to fund collaborative projects that address those gaps that we identified in the Iowa Cancer Plan. And just want you all to keep in mind that like our staff is like ready and willing to help anybody through this process as well, if grant writing is new for you. So award amounts are definitely like dependent on the funds available from any given year, but we do allow applicants to apply for up to $25,000 per year for a project. And we also invite folks, you can apply for a project that just spans a year, or it can be up to a 3-year maximum, where you'll have like a competitive reapplication each year. Usually our average implementation grant award is usually somewhere between $10,000 and $15,000, but honestly, it just depends on the projects. The use of grant funds, just some of the nitty gritty. So things, allowable expenses are staff salaries, consultant fees, funds for data collection and analysis, meetings, supplies, project related travel, and other direct expenses. We do have a policy that we are able to support indirect or administrative costs up to 8% of the funds. So if that of the funds requested. Things that are not allowed are lobbying, funds to replace dollars that are currently earmarked for other cancer programs, clinical care, including the provision of things like medication, vaccinations, or cancer treatment. However, we do kind of have a gray area for consideration. So the board will look at grants that specifically ask for things related to service delivery. So that could include things like radon mitigation or cancer screening. Those will be reviewed just on an individual basis. So one other thing that we've encountered before, we really want our applicants to use the evidence base, like what's out there. And so we do know that there are some community interventions where incentives work. So just a note about incentives, they are an allowable expense if there, is a paper or something that can be like proven to be effective, but it really does have to be explained in the grant, and we may ask you to elaborate further. As far as project reach, the project activities must serve predominantly Iowans. As far as evaluation, we do send out all of the applications we receive to independent reviewers outside of the state of Iowa. Usually we have between like 3 and 5 outside reviewers score these grants. They're also scored by our board of directors and also like discussed and voted upon by the board of directors. And just a little bit of a note here, the scores from the reviewers across the United States are used to assist the board in making their decisions. However, the board is ultimately responsible for choosing which applications are awarded. And then, with the consortium, we want to be good stewards of grant funds, but we also know that communities know how the funding needs to be spent. So we try not to put too many roadblocks up with monitoring. But our staff do work closely with grantees just to ensure that they have the tools to be successful with those funds. So we do require that folks submit just quarterly progress reports that include like a short narrative about what's going on, what some of the difficulties might be, what's been unexpected or gone well, as well as kind of like that financial update so we can make sure that the funds are being spent correctly. So additional details and reporting dates, obviously, will be shared with the funded applicants upon the award. So just a little bit about what you need as far as a checklist. So we do ask that any folks that are interested in applying do submit a letter of intent, and that is due, or it's due to Liz Orton on April 3rd by midnight. And it doesn't have to be fancy. We do have drafts on our website, but it's really just to help us know the volume of grants that we're going to have and help us prepare for how many reviewers we need. Let's see, you do need to make sure within your application that your project addresses the different goals or strategies within the Iowa Cancer Plan. So just make sure that you're linking back to language there. It's very important that the budget items are explained and the totals are accurate. It just really helps for the credibility of different grants when all those budget lines add up, and that we don't have to go like digging for a lot of the information. So as much detail as you can provide, the better. We do ask for letters of support included from all collaborators on the application. And again, it doesn't have to be anything earth-shattering, but just a real simple letter of like, yes, we're this community organization. We know we support this person and submitting their application, and like this is what we plan to do with the project. If you have any staff member that is going to be funded off of the application, we do ask that you include a resume or CV for that person. And if at all possible, we prefer the application documents are compiled into a single PDF, just that we can kind of keep all our ducks in a row. However, we know not everybody has access to that kind of software, so we're able to kind of put that together as well, if that's a need. But the complete applications then are due to Liz Orton by midnight on May 5th of this year. All right, and yeah, you can find samples and this whole checklist on our website as well. All right, so other than that, I just wanted to share a couple other resources that we have available for you. So on our website, you can read about previously funded projects. We also have links to different websites, different national websites where you can learn about EBIs or evidence-based interventions of public health. And I think this is especially important for any project that might be in like the prevention cancer screening realm. You'll want to look there. We also have links to the different Cancer in Iowa reports from the Iowa Cancer Registry. That includes Iowa specific data and also kind of like a deep dive sometimes into more specific topics. So this year's, it's kind of like the 50th anniversary of the registry and focuses on high and rising cancer types. But if you go back in previous years, there's a focus on cancer screening and also racial health disparities that are really good nuggets of information that you might want to include in your grant proposal. Also, like many organizations, the American Cancer Society has very clear recommendations for returning to screening for COVID-19. So that might be helpful for some of your applications as well. And then one thing that we really like to do in public health spaces is really focus on like those SMART or SMARTY objectives. So just really making sure that you're being very clear about what deliverables you want, what the timeline looks like, and how it impacts equity. So we do have more resources available online for that as well. All right, so just a quick overview of the timeline again. So like I said, we do require a letter of intent. So those are due on April 3rd. I will just say, like other grant mechanisms, we don't like invite you to apply. So by submitting this letter of intent to apply, we know that you're going to submit something. So you don't have to wait for our approval. The full application is due on May 5th. And then tentatively, we anticipate folks will be awarded or like receive their notification at the end of June. And then the project period will begin July 1st and then last through May of 2024. Okay, and I hope I hit this home throughout the webinar, but like the consortium staff, we have nothing to do with choosing who receives funding or not. We're just here to really help provide that technical assistance to community members and really just be there to kind of like help make your application the best that it can be, because it's our board that ultimately decides. So we really do want to encourage you to connect with any of our staff. We can either discuss or review your application or link you to other members that may have done something similar. However, you know, if you're like, I got this, I don't need to do that, it doesn't affect your score either way, but we just want you to know that we're here. So we did include our general staff email if you want to reach out to that, or if there's a specific staff member you want to reach out to, that's okay too.